Welcome back, team, to episode 4 of Plastic Surgery Untold, Beyond Botox and Butts. Today, our topic is New Year, New Me. We're talking all about mommy makeovers. I'm excited to have our co-host again, certified registered nurse anesthetist, Travis Osborne, also known worldwide as Celebrity Anesthesia. And then Megan Parkin, who needs no introduction, social media influencer and YouTube vlogger, blogger, and all of the above. And then, by popular demand, over and over again, we got Gilberto Saenz, physician assistant and celebrity injector.
Thank you, guys. Appreciate you all having me back again.
Well, I'm excited to start off the new year and be working hard. And so, since we're in January, I kind of wanted to talk about, we usually give people a little update what's going on in our lives. If you guys don't mind, we'll mix it up a little bit today and do New Year's resolutions.
All right. New Year's resolutions.
You want to kick us off?
Yeah, might as well.
Go. Let's do it.
So we have 3 at our house. We're going to try to do. Number 1.
When you're married, is it a group resolution? Because you said we have 3 at our house. I'm just trying to figure out what's going on here.
Mostly because it's
as 2 single guys here, we don't really say we.
mostly is a timing and schedule thing at our house. So want to try to work out more than 4 times a week.
Okay.
Or at least 4 times a week.
Okay.
We want to do at least 4 meals a week at the house. And then also want to try to meditate at least 5 times a week. Gotten a little bit into meditation, not trying to get too woo-woo spiritual on you guys, but it's cool, and I want to practice more gratitude, and meditation is kind of the key to that for me.
So like meditating at home, or like hot yoga, or goat yoga? Have you ever done goat yoga?
I haven't. Mary has. She actually has a pretty funny story about goat yoga. I'll have to ask her sometime. But this is more just at home. Sometimes sit in the hot tub, do a little 10-minute guided meditation. Nice little way to start the morning or cap off the night.
I mean, I'll take some hot tub, meditation.
Hot tub meditation?
Yeah.
There you go, man.
Boom.
Yeah.
Megan?
I got kind of a boring one, but I think I want to try to read at least 1 book a month and try to carry that through the whole next year.
I thought you were going to say year, and I was like, that is lofty goal.
I'll read 1 book this year.
I want to read.
If you stay up till 5 a.m. every day, you can crank out some books.
Okay.
Do a couple questions. 1, does audiobooks count?
No.
2, what's number 1 book on that list?
I'm not sure. See, I got to figure that out.
I guess if any of the listeners want to hit us up on the DM and give Megan some advice.
I think it also might help me go to sleep. Like, don't you think reading makes you tired? I mean, before bed, if you read a little bit.
Not if it's a good book. Then you're like, I can't put this page turner down.
Maybe.
Well, if you got any, at Megan Parkin, send her some book advice. Gilberto?
I've got a couple.
I like the way you said I instead of we, but continue.
Like most everyone else, maybe get a little bit more active and try to get back into, racing shape. I used to do a lot of long distance racing. Maybe do some more community service, volunteer a little bit more. But most importantly, probably spend some more time with my family. My brother lives in Austin, and I don't get to see him as often as I'd like. He has a couple kids, and I'd love to see them a little more often. So just spend more time with family in general.
Very cool.
Gilberto, awesome. You are a good quality man. I personally don't understand how you're single, because you are a quality man. So ladies,
maybe he's single by choice.
You think so?
Yeah.
I mean, I can neither confirm nor deny that.
Okay.
What about you?
Those are some quality ones. Mine are a little bit more selfish than Gilberto, I'm not going to lie. Goal number 1 for me is actually to get myself in a little bit more of a fitness type shapes things. Weight issues definitely something that I've personally struggled with probably the majority of my life. So my goal by the time we hit episode 25 is to be down 20 pounds. So I will weigh myself today. We will check in at episode 25. We'll put that on producer Donald to check us in at episode 25 and see where we're at. So I think those are some quality ones.
I do too. I think the biggest things for me for New Year's resolutions is it's got to be attainable, and it's got to be something that you can measure. There's got to be some way that you're holding yourself accountable. For me, it does help when we talk about these things to rope Mary in. I know it's boring, the married couple on the show, but it really does help to hold me accountable and just say, hey, we haven't eaten at the house 5 days this week. Let's cook at home this weekend. All right, cool.
Well, and that's why I think like setting specific times like
Absolutely.
this. Hey, by this time we're going to check. By this time we're gonna do that. And is it true this year that we're going to do a little fashion off between your trendy therapist and at Megan Parkin? Because this would be honestly phenomenal. And so I just, not to give our fans a little bit of a teaser, but we talked a little bit about this possibility.
We did.
We have
Maybe
some good ideas coming
who
up.
can dress us the best, or who can style.
I'm
an
just
outfit the
saying,
best?
if your trendy therapist loses, somebody may need to take in celebrity husband for a week or two. So, on that note, before he gets kicked out of the house, let's get started. Today, Mommy Makeover. I think is such a fitting topic to kicking off the year because there's a lot of reasons why people want to do a makeover, and we call it Mommy Makeover, but we're going to kind of talk about everything encompassing of what people do in terms of transformation. A lot of reasons why people need or want one. We had talked about it in previous episodes about, I think number one is why are you doing this? And before we even get into any of this, and I know we've talked a lot about this, and making sure the reasons are really for you. And it can be all sorts of stuff. And honestly, for our practice, we see a lot of people who have taken care of their kids for the last 15, 20 years, and now it's time to do something for mom. Mom just wants to do something to restore the body they once had. Or the flip side is after a lot of weight loss. People have worked really hard, have accomplished all these tasks, whether it's eating right, working out, typically a combination, and they're like, hey, now I've done this and I just got some loose skin. I want to get back into a good spot. So
what actually is a mommy makeover?
I think that's a phenomenal question, and we get that on the DM all the time. And so Mommy Makeover is usually a combination of procedures that includes something breast, something tummy, and then plus or minus some liposuction. So it can be a tummy tuck, it can be a breast dog, it can be a breast lift, and this goes to some of the stuff we've talked about with Gilberto in the past of finding a provider that's going to help you and what actually is going to help achieve those goals.
And is that all performed in one surgery, or do you have to do it in sessions? How does that work?
Great question again, and some of this goes to what we do at the surgery center with someone like Travis, because we do try to limit the amount of time that somebody's in surgery. I think when surgeries get long, there's no question there's good statistics out there that your risk of complications goes up.
Absolutely. Anything that's approaching the 6-7 hour mark, me and you always talk about, or you and whoever's doing your anesthesia that day. Normally it's me, but yeah, that's definitely something to visit.
And so a lot of times it's a couple things. It's one, how much time off do people have, and we'll get to recovery dictates a lot of this. Two, just kind of what people are willing to go under. A lot of times people do want to group a lot of things together, just because of time being off work and then being able to do again. But safety is always the number one thing, and so that really limits some of what we can do, because that has to be the priority for any type of aesthetic procedure.
Course. Absolutely.
Why don't we just kind of work our way down? And I know we've talked about breast implants and breast lift and stuff before, but as part of a mommy makeover, one of the things I hear most commonly is people just want to restore what they once had. And whether it's from weight loss, from pregnancy, it's trying to restore that and get that into that shape. I think people just want that fullness back, and that's where our gummy bear implants come in. And for those of you that are following us on YouTube or Instagram Live, the gummy bear implants have become so popular because they can give people the fullness but still have the softness.
You don't look quite as augmented or quite as fake as you would have in the past with big, full, overfilled saline implants, I think.
Yeah, because people are afraid of that coconut look, and wanting to look afraid to look overly round. And I always tell people that, you want to get into a happy spot where you can dress them up, dress them down. It's a spot where people are going to be looking, if they're out on date night, whether it's Tinder or it's complicated, they're going to be able to look good. I mean, would you say that is something that people look for? Or I know you do a lot of stuff on YouTube. Comments that you've had from people about breast dogs, other things like that in terms of goals?
I mean, what do you mean? As far as wanting to look natural, or just...
Yeah, whether people like the natural fullness. What have you...
I mean, I think it really just depends on your own personal style and what you kind of want to present yourself as. I mean, I think, like you said, there's no right or wrong way. It really just depends on the look that you want, but you can obviously guide people towards maybe an avenue that's better.
And I think that's a great point, is trying to be more of a guide than, hey, this is what I like. Because, and I think people don't realize, and this is part of the show of why letting you guys know that we're real people too, is that I think people don't realize, surgeons, anesthesia providers, PAs, everybody, we're social media, moguls are all real people. And so, we have biases too, and try not to let our biases affect other people, because obviously if you're the patient, you're the one that's going to be walking around with this look. And so I think super important. So even as part of a mommy makeover, we still do all the sizing where people come in You try on some implants, get a good idea. During that consultation, we talk about whether you need a lift or not, and all that goes back to affecting the time of surgery.
So, and when you said lift or not, and aug or not, what's the difference between the two? Or why would someone need a breast augmentation with just implants? Or why would someone need implants plus a lift? Or maybe just a lift?
I think that's a great question. Typically people need a lift if they just have an excess amount of skin. So like anything, if it gets stretched out and then deflates, sometimes just filling that breast isn't enough. I also tell people, be careful of falling into the trap where you get an implant that's too big, that you're not happy with it because you're just trying to avoid a lift. What typically ends up happening is you feel too big and now you've paid for surgery and still end up getting a lift down the road. So, kind of a good rule of thumb is where your nipples are. So if your nipples point towards your toes, probably need a lift. If the nipples are pointing straight forward, then typically don't. Obviously, that's an overly gross generalization, but gives you a little bit of an idea.
Yeah.
And part of those different surgeries depend on how much time the surgery is going to be and recovery, because I think recovery is a big part for people, and everything that we do, people also want to know how much downtime and work, everything else.
Absolutely. I mean, we're in different fields, obviously, and what I do is a little bit more minimally invasive compared to what you're doing, but I get the question all the time, like, how much downtime do I have, do I have to expect, and, can I go back to work, what can I expect, things like that.
But in terms of mommy makeovers, I would have to think, and we do a lot of body procedures, but you who do a lot of Botox and Faux stuff, you have to get some mommy makeovers of people just trying to freshen up their look. Is that true?
Without a doubt, absolutely.
What are some of the things that people come in asking you for after weight loss or after losing weight after pregnancy and so forth that you see?
A lot of that is just revolumization of the face, really. Extreme or excessive weight loss can sometimes create kind of like a gaunt look in the mid-face and the cheeks or in the temples, and so sometimes it's just creating a little bit more volume in those areas to round the face out a little bit so it looks a little more natural, not so gaunt, like I was saying.
And that's what I think is super cool about aesthetics and so forth, is you can do the full extreme mommy makeover where we got tummy tuck, breast lift, augmentation, but you can also just do a little bit of touch-ups.
Absolutely. Gravity plays a role on all our bodies, and in the face anyway, over time we just start to lose a little bit of that support and fullness, and so using the right type of filler in the right places, you can actually create a little bit of a lift and create more support for the face.
I think one thing that we try not to lose sight of, and I always ask people, is what's most important to you? Because in the end, it's trying to build what's going to build their self-confidence. And I don't know if you have any other thoughts about good ways to reach that, but it's, to me, if you guys don't mind me digressing, telling a little story, it's so funny because you never know what's going to bother people the most. I had a patient when I was in Miami, and I walked into the room, and she had been in a horrible accident and had this deformity of her nose. And I was like, what bothers you, or what can I help you with? And she's like, I want to lift my breast. I was like, oh, okay. And it's just, you just never know what bothers people and what's going to help their confidence. Because I think that's what's super important.
For sure, yeah. And I think that can be also like a touchy subject for people, having to come in and like be really open and honest about what it is they want to work on or what they want to change. But I think as long as they feel comfortable and they feel like validated in what they, are looking for, I think it's a good route.
Kind of moving down, so we can kind of touch on everything in terms of mommy makeovers is the tummy. And I think that's almost a hard one. I think people want to avoid the tummy tuck. Most people would rather do lipo and just remove a little fat and use some tiny little incisions. But again, go to the issue just like the breast lift. If you got too much skin, then we've got to get rid of that.
And then the other underlying part of a tummy tuck, I think you can talk about, much better than I can, but there's another portion of a tummy tuck that's below the surface that helps quite a bit too, especially after pregnancy. And
why would you say people want to avoid that? It's just...
I think, one, it leads to more downtime. And so the recovery, when we're talking tummy tuck, I typically tell people they need to give themselves at least 3 weeks. Doing too much is going to lead to problems. With liposuction, the incisions are really, really small. With a tummy tuck, depending on how much skin, you typically have an incision that's longer than a C-section scar for sure. The other parts of that is just how much recovery I think they're going to have is really hard for people. 3 weeks for a lot of people is a decent amount of time.
Right.
And the scar. I think those are the two big things that sometimes worry people. But to your point, a lot of times the muscle gets stretched out. That can't be fixed with liposuction. And so we people get what's called a diastasis rectus. And as you know, it's really hard to fix without surgery.
Absolutely. I mean, would you, not to go off subject too much, but do you feel that new minimally invasive, non-invasive procedures like M-Sculpt can help with the diastasis recti?
I do think M-Sculpt is one of these kind of incredible things that has just started to take off. It's a whole new paradigm of building muscle, strengthening muscles, and so forth like that. And so, because I think you've actually had your belly done.
Right.
Do you feel like it helped your diastasis a little bit?
A little bit, yeah. I feel a little bit more tight in the core area. Certainly,
Because you're preparing for Speedo season, if I'm not mistaken.
100%.
Not to jump too far ahead, but I just can't help myself. There's a little section we call Factor Fiction, and I'm just going to ask you one little nugget. Factor Fiction, you're infamous for wearing a white, velvety, soft shirt to our last pool party.
It's more terry cloth than
terry cloth.
Velvety, but that's fact.
Because people said your belly looked washboard in that.
Oh, yeah?
And I don't know if I'm not going to say that was from M-School, but I'm not going to say it wasn't.
Maybe I need to get in for a few more sessions.
So, reel it back in a little bit. But I think, all of us, and whether it's men or women, we all get a little self-conscious, and especially in a city like Austin, Texas, where we're so fortunate here that it's nice 9 months out of the year.
So is there a daddy makeover?
There should be. I definitely think there's daddy makeover. I've been accused of having a dad bod, and I don't know from your own personal, is that a compliment or not? Are women into dad bods?
I think it depends, honestly.
I heard it was a thing now.
Yeah.
Would you, if somebody, I know you're in a complicated relationship right now, but if you were scrolling through Tinder on your free time and someone said, I have a dad bod, would that be?
I think if that was in their bio, I'd be like, why are you telling me that? I would just be very
because it's this whole age of transparency and honesty and being upfront. It's like, boom, I'm owning it. Dad bod, here I come. You're speechless. Okay.
I think that says it all.
I think Megan's going to take a no comment to keep herself out of trouble here. Just again for the second time to reel it back in. In terms of mommy makeover stuff, this is where I think it's super important in terms of coming up with a whole type of thing that's going to reach your goals, that's going to transform you, and then that recovery time really varies from person to person, because somebody may need a mommy makeover and they get a breast dog to just refill their breasts that have been deflated, and maybe some liposuction to help shape them. They could be out 5-6 days and be back to work. Where if you get a breast lift, tummy tuck, lipo, you may be 3 or 4 weeks depending on everybody. There's definitely some things that have made recovery a lot better. It's not like the old days. You can't be in bed for a week. You gotta get up. We get people walking the night of. We actually send all our tummy tucks home with compression devices to get the blood circulating. We do something, and hopefully Travis can jump on this, but again, we use a drug called Exparel that actually we inject into the muscles to help with it. And so besides the Exparel and other things, there's some few things from an anesthesia standpoint that have really made recovery better.
Yeah, and I've talked about this in a couple of our previous episodes, but loading patients with gabapentin and other drugs that are non-narcotics to try to offset those pain receptors before we even get started with the surgery. Other thing that we do and you try to do is depositing local anesthetic to bathe those nerve roots and those nerves at the skin level before we're even making incision. So the goal is that you're not feeling anything, even though you're completely asleep. We do all these cases under general anesthesia, which means you're completely asleep with the breathing tube. But even that being said, we still don't want you to have any pain while we're doing these cases. So anything we can do to ablate the pain response, the better.
Can you explain to people a little bit about Exparel? Because I've talked about it and I probably haven't explained it well enough.
Yeah, so Exparel, we have these regular local anesthetics. Exparel came out, and what they did is they made this liposomal bupivacaine. So bupivacaine is a local anesthetic that bathes nerve roots and makes them numb, per se. And what this liposomal bupivacaine does is it slowly degrades the liposome that engulfs the molecule. So over time, you get more and more that's starting to come out and seep into those nerve roots that allows them to be bathed in local anesthetic. So it's a long, slow-acting pain medication. We typically aim for 48 to 72 hours of pain relief, which is a huge change from the 4 to 8 hours of pain relief that you were getting from regular bupivacaine.
If anyone would like to pause the podcast and Google some of those terms, we're not going to judge you. We are not going to judge you at all. But the long wind of this is that it really helps people get up and moving because we worry about blood clots, those type of things. And I think people don't realize how much stuff goes into a good recovery for people.
Oh, yeah. And I think the most important thing is having a good team and support system at home. How am I, and thinking about these things preoperatively and weeks before too, how am I going to get up and out of bed? How am I going to get out of my house and up the 3 steps that I need to get up to my front door? Just things like that you don't think about until you're actually in there. How am I going to lay in the back of the truck or the back of the Suburban or whatever as I'm getting home in this position? So a lot of things to think about.
I think we see it in our practice. If people have good support and someone to help them, they're going to do well. People who don't have support tend to do too much and have problems. And I think we see that across every field, no matter what. Oh, yeah. I mean, even from skin cancer excisions and other things, you need some help to keep moving.
Oh, yeah, absolutely. Absolutely. Couldn't agree more.
Megan, something in your experience, I mean, I think sometimes it's hard because going into things, people don't realize how much help they need going into stuff. And it's easy to think, I'm Superwoman, I do everything, I don't need help.
Would you even say that maybe bringing your husband or someone else that's going to be around to help you would be okay to the consultation so they can kind of hear what's going to go on, what to expect?
I think if you can bring somebody with you, it's even better because it's a lot of information. And when you're on the point, it's easy to forget stuff. Also, people may or may not realize this. There are a couple margaritas under the wind after surgery. So, there's only so much after, a surgery that I can tell them in the recovery room, about what to do and post-op instructions. It's nice for them to be there and ask questions. Also, I think, we forget about emotionally. People need some support.
Absolutely.
Most patients go into a little bit of like a post-surgery depression, and I think it's just from being taken out of your routine. I mean, if you sprain your ankle, it's tough to not be able to do stuff. So you could imagine from a big surgery.
And especially think about a lot of these patients are moms. They're used to being super women. I mean, they're taking care of a couple of kids. They're taking everybody to basketball and football practice and juggling 10 different things. So when they're taken out of that rotation and they're forced to actually just chill for a couple weeks, that's a big difference in their life.
And would you say the mommy makeovers are one of the most transformative things that someone could undergo? Because I feel like emotionally that could also be a lot to deal with, and mentally kind of.
I no question it is, and I sometimes there's even because moms spend their entire life taking care of someone else, and I think it's just so hard for them to wrap around the thought that they're doing something for themselves, and it's almost this guilt of being selfish instead of realizing hey, I've given my body literally for other people for the last 20 years, and it's okay for me to take 3 weeks for myself.
Oh, yeah.
Right.
I always tell people, moms and farmers that they heal because life keeps going on. They will take care of their kids. They will take care of everything. And so I think the hardest thing is just getting them to relax for a little bit.
Absolutely. But it's got to be a huge confidence booster for them, right? Going through such an invasive procedure, and then, the outcome, months later. And
what's cool about that procedure in specific is on the table, from my standpoint, it is one of the most transformative within a 6-hour span that you can possibly go through. And it's pretty remarkable what he's able to do and what we're able to do in a relatively short period of time.
To kind of sum some of this stuff, and I know we kind of grazed over a lot of stuff, but Mommy Makeover is a massive topic. We're definitely going to do some more podcasts on tummy tuck specific, liposuction specific, in some other transformation procedure stuff. But I think a couple big things is, one, it typically includes a breast and tummy procedure with or without some lipo. And this is where having a quality provider can help guide you to what procedure is right. I think somebody touched on it, having a good support system, because you need physical and emotional help after this, making sure you take enough time off work that you're going to heal really, really well and get that good recovery. I think making sure people sometimes think about the surgeon provider, but also knowing who's doing your anesthesia.
Absolutely. It should always be either a board certified anesthesiologist or nurse anesthetist, in my mind, doing your anesthesia.
And not to shamelessly plug us, but we actually have an episode coming up soon about anesthesia, and we'll talk about some of those different options.
Absolutely, and some of the things that we're doing and what we've changed along the way to kind of make things a little bit better.
Anything else to add for your fans out there about mommy makeovers before we move on to my favorite topic?
I mean, I just think it's interesting that you said it doesn't necessarily have to be someone that's gone through pregnancy. Like, there are other options as well.
There's a lot of really young people or even some older people who've either had a gastric bypass, who've had some type of weight loss surgical procedure. And also there's just some people who like made some lifestyle changes and lost a lot of weight. And I think people think that it has to be someone that's lost 100 pounds. 15, 20 pounds can make a big difference, especially if someone isn't super tall, isn't really big. It can make a big difference.
Absolutely. And just one thing I wanted to add. Mommy, and I know we've spoken about this offset several times, but Mommy Makeover is not, or a combination of breast lift and some kind of tummy procedure and lipo is not a weight loss procedure. This is what's happened, after years of putting in the work, and you've had some body changes. We're hoping to bring that body back into shape, but this is not something where we're doing gastric bypass where it's a weight loss procedure.
No, most people right after the surgery are actually heavier. I mean, a lot of that comes from fluid and so forth like that. But yeah, a tummy tuck maybe removes 3-4 pounds. That's max. And so I think that's an incredible point. Well, I think that's been an incredible talk. I appreciate you guys about Mommy Makeover. So now we're going to go to my favorite section of the show, a little thing we like to call Fact or Fiction.
But whoa, Dr. Johnny, we are taking it from you. We're hijacking Fact or Fiction.
You going to take my favorite section?
We're taking it from you. You're in the hot seat.
Oh, yeah, let's do it. Let's do it.
I got one ready for you right here. Fact or Fiction, you played college football.
Ooh, that is a fact. Maybe we'll have to go a little retro, post a little Instagram. I was actually a quarterback. Yeah, 4 touchdowns, 1 game. No, I'm kidding. That's false.
that is
sounds
fiction.
awfully familiar to Al Bundy.
That was an Al Bundy reference.
Little Uncle Rico action.
I played in Wisconsin. Yeah, played a little snow games. Thank you for recognizing my athletic ability.
Absolutely, man. Absolutely.
So, fact or fiction, you spent more than $500 on your little shopping trip to prepare for the podcast.
I'll be honest, I didn't end up buying anything. I had a suit that I loved. It just didn't quite button in the right spot. Okay. So it's a little bit of a sensitive subject, but I appreciate you bringing it up, Megan. Thank you.
So
Thank you.
That was fiction.
That was fiction.
She's like, keep it simple. It's fact or fiction. We don't want to hear your sob stories.
Gilberto, you got anything for him?
Fact or fiction? Should I give him a softball or?
Oh, no, softball.
No.
Like, toss that little baby up. like a little sweet little implant.
Well, I feel like you put me on the spot a couple of times, so I'm going to put you on the spot today.
Definitely.
Fact or fiction? You one time found someone taking a bath in your tub in the middle of the night.
I'm gonna say that's a fact. That's a fact. And they just, I was like, "What are you doing?" They're like, "Just chilling, just chilling."
All right, back to
You were killing me. Well, I'm glad that we could bring a little joy to everybody's house. My favorite, fact or fiction. I'm not gonna lie, I like it better when I'm asking the questions. Now we're gonna go to another crowd favorite, something called Behind the Bovie. And this just gives people a little bit of an insight into what's going on. I think in a side of plastic surgery that people don't get to see.
Oh, all right. I like that. This week, should we talk? Should we tease a little bit of anesthesia since we're doing that in a future episode?
Why, please?
Okay.
Travis has been waiting for this.
Oh my God, I've been waiting for this. So one thing that people do not necessarily know, there are several different types of anesthesia. For a Mommy Makeover, we do general anesthesia for anything where we're doing a tummy tuck because we actually need muscle relaxation. So that means you go all the way to sleep. And we give a combo of drugs that within about 10 seconds takes you from completely awake and conscious to completely anesthetized and completely lose consciousness in your airway reflexes.
Can I tell you, I think one thing that, from talking to people in our office that people don't realize to that point is that there's a separate provider, i.e. someone like you, who is just with the patient the entire time. And yes. I think people, obviously, being a quarterback, I feel like being the plastic surgeon is much like a quarterback. You get all the fame, all the glory stuff, but don't realize that we couldn't do our job without the assistance of someone such as yourself, who is solely there to make them comfortable and make sure everything goes smooth so that I can focus on the other part.
I like to think of myself as the tiny offensive lineman, just blocking in the trenches.
I mean, there's a reason offensive tackles go early in the draft.
Right.
There is a reason.
We are there sometimes it is behind the scenes. I mean, you meet me for 5 minutes. I talk to you about anesthesia. We do a quick health history, and then we take you back, and I get you off to sleep. And once you're asleep, I'm watching you for the next 4, 5, 3, whatever hours it takes to actually do the procedure. There the entire time. I don't leave. You're on monitors the entire time. And then when it's time to wake up, it's kind of like landing the plane. I'm there to wake you up, get the breathing tube out, and take you to the recovery room. Make sure that you're nice and safe before I turn your care over to one of the PACU nurses or recovery nurses that's going to hang out with you for the next hour or two.
On that note, Megan, if Travis is the offensive lineman of the podcast, if I'm the quarterback, would you say that Gilbert is the place kicker or the punter?
I would say he's the punter.
The punter. All right. What is Megan?
Well, Gilbert, in return, what would you say Megan is? Be careful, you say defensive lineman, you cannot make it out.
I don't really actually know what I just said.
Cat's out of the bag.
Yeah, I think
no one knows about
place
football.
kicker would have been a better.
The other one sounded more
At least
official,
they score
honestly.
points.
That's true.
I mean, would you put Megan maybe a show-stopping corner? I feel like she'd be a corner because, very specialized, very skilled, but likes to do her thing.
I could see that for sure. Definitely.
The references are going above my head here, but
we'll bring it back to something more pop culture.
Yeah.
Well, I appreciate everybody. I think this has been a phenomenal episode on Mommy Makeovers. I promise, guys, we'll dive deeper into each one of the procedures in the future. So that'll make stuff a little bit easier, but it's nice to have at least a big general overview before we get started. I'd like to give a plug, as we've already kind of alluded to a little bit. Anesthesia is going to be our next episode, and so we'll hear more from Travis, certified registered nurse anesthetist. I know that a lot of people have been hitting us up on the DM and saying that Travis doesn't get enough airtime. So your wish is coming true. He is coming to all of you, I promise. I think most of those came from your trendy therapist. I don't know if you know her. I'd also like to thank everybody for joining us, for listening, and of course, a special shout out to our producer, Tall Gamer, Donald. Thank you, sir.
Thank you, Donald.
Awesome. Boom.
Boom.
Boom.